Can you talk a little bit
Yes.
more about the specific techniques where we can try to preserve fertility in these young cancer patients?
Yes, so there are several techniques, and I think going one by one. For example, embryo preservation, which is a technique that allows us to preserve the egg already fertilized and save it for later after the patients undergone their treatments, and then can be utilized later on. For example, egg freezing, which is to retrieve an egg, utilizing techniques to actually stimulate that ovaries to produce an egg, and then again freezing, and then to be thawed, to be warmed up when it's time to be needed and installed back into the patient's body. So gonadal shielding, which is to protect the ovaries, for example, from the effects of radiation therapy. We can sometimes use some form of walls or blocking in order to allow to do that. And then ovarian transposition will be, for example, to move the ovaries of a female outside of the radiation field.
Okay.
So every time that we are talking about radiation, we're talking about a field, an area where radiation will be covering the body. And when that includes the pelvic area, certainly the ovaries will be included in that area, and for which sometimes moving them outside of that field will save that tissue for future. And obviously, particularly for patients with cervical cancer, the removal of the cervix, but leaving the uterus intact. Remember, for the audience, cervix and the uterus is a single organ, right?
Correct.
But sometimes when we're dealing with cervical cancer, we have to remove that cervix, but there are techniques, particularly named trachelectomy, that allows us to preserve the uterus without the cervix, and eventually a viable uterus for future use.